Hello everyone, really nice that you can join us for lunchtime. I'm assuming you can see me, and if you can see me you're going, what's up with the eye patch? So I have a squint and it gets corrected by me getting a Botox injection into my eye, which is a bit stressful to be honest. But anyway, the consequence of that is this eye goes out that way. So not only do I look really weird, but I see double. So this is not, I haven't put this accessory on to try and look interesting or cool. It's just, it allows me to see. Anyway, Anna, thank you for the introduction, and James, thanks for organising this through Drug Science. I basically want to whip you through some of the things that we found out when we ran a big survey earlier on in the year, focusing on the impact of COVID on people's mental health and their drug and alcohol use and their relationships with other people. For those of you who don't know about Global Drug Survey, we run the world's biggest drug survey, and I think since 2012 we've had over 900,000 people who take part. We started off just in English, but our last survey was translated into 18 different languages. And the last survey, which ran at the end of last year, which was GDS 2020, had 110,000 people who took part. The results normally come out in May, but COVID kind of put the kibosh on that. So we're actually going to release the results when we start the next survey, which will be, I think, on November the 1st, 2020. So keep your eyes open for that. We're a independent research organisation, so we don't get money from governments or large research grants. And we've taken that decision to basically give us the independence and freedom to ask about things that we think are really important and that we know are important to people who use drugs. So we don't focus on treatment-seeking populations or people with severe mental health problems. We focus on the hidden masses of people out there who use drugs and for whom drugs are one of a number of, things they do in their life, like, doing yoga or being a vegan. And our mission is simply to promote honest conversations about drug use and to help people use drugs more safely, regardless of the legal status of the drug. And that's really important because the two drugs that kill more people than anyone else by a factor of 10 are alcohol and tobacco. But there are safer ways of using those drugs, and we've got guidelines, not that anyone really listens to them. And we should have that same opportunity to have honest conversations with people who use drugs. The other advantage of not being reliant on funding streams is that we can very quickly explore new areas without having to apply for a large grant. It also means that we're always looking out for bits of dosh. So the Global Drug Survey, once upon a time, started off as the Mixmag Drug Survey, which was a paper and pen exercise that was sent out in the Mixmag survey about 20 years ago. Now it's an online anonymous confidential survey that uses an encrypted platform that gets promoted through our media partners and social networks. What's really important to understand though about Global Drug Survey is this is not a national household survey. This is not a nationally representative sample of any country. This is a non-probability sample. And for years there's been arguments about, well, does this offer anything at all? And increasingly, there's been some really nice editorials that have come out from, for example, the EMCDA in Lisbon and from American groups that are basically saying, look, just because you purport to have a general household survey doesn't actually mean that it's a valid and reliable reflection of what's going on in the general population, because many groups won't be counted in a household survey. Homeless populations, people in prison, students. And in the same way, you can't dismiss the value of a non-probability sample, but it depends what the question is that you're asking. If you want to know how many people use cannabis in a population, don't come to the Global Drug Survey. But if you want to know what's the impact of nitrous oxide on the risk of nerve damage, then we can answer that question, because over the years we've had 20,000 people who've used nitrous oxide in the last year, and we were able to obtain really granular data on the relationship between dose and exposure and the risk. By the way, nitrous oxide does inactivate vitamin B12, and about 3% of people who use nitrous report persistent numbness and tingling in their fingers and feet and around their mouth, consistent with a peripheral neuropathy. And so, although nitrous is a remarkably safe drug, I mean, in our sample, we had 1% of people who were using more than 100 days in a year and using more than 100 balloons in a day. So there's always the outliers. But the truth is there isn't a single data source anywhere in the world that gives you the whole picture. This is about taking different data points and putting them together to give a clearer picture. And Global Drug Survey is just one of those sources. One of the other things that I think makes us a little bit different is the first time anybody sees our reports are when we release them to the general public. They don't go through governments. We're not kind of sanctioned about what we can say. And it means that we can ask things that are kind of challenging to existing policy and that people might be interested in, which is, you know, important if you want to engage people. And we'll talk about positive drug use effects and negative drug use effects. And that includes things that hopefully can move, for example, the renaissance in psychedelic medicines to move forward by demonstrating that these drugs aren't drugs of abuse. People don't become dependent and they are remarkably safe. The other thing we do with our data is we create a range of free apps and harm reduction tools. So we've got these for alcohol and cannabis and other drugs like the drinks meter. We've got a 3-minute self-assessment tool for cannabis at safer use limits. We've got the drugs meter apps and we've got the highway code, which is a harm reduction guide voted for by people who use drugs. And we've also got this one for alcohol, which is called onetoo-many.co. And that basically tells you how much of a twat you are when you drink. It doesn't ask you how much you drink, it will just give you an ARS score that stands for alcohol-related social embarrassment. And yes, I was crazy proud of coming up with that acronym. But because we're also a group of academics, we make sure that our work filters out to the academic press. And I think we've published about 60 papers over the last 8 years on various topics. And the reason that we think Global Drug Survey is needed is that the debate is so polarized out there about drugs being good, drugs being bad. And the truth is, it's neither of those things. The kind of truth lies in the murky middle. It's kind of the grayness of things that is where the truth is. But we also need to have evidence to challenge, you know, the dominant, you know, view of so many governments of zero tolerance. It doesn't work. It's not helpful. It punishes people, increases harm. In fact, there's virtually nothing in this world I think we should have zero tolerance for, apart from people like that, fascism, racism, bullying little kids, and I will add to that my own personal list, which is pineapple on pizza and people who wear socks with flip-flops. I just think that's a crime. And of course, this man. Anyway, it was really nice in about 2018, The Lancet wrote an editorial around our work, around how we're trying to change that conversation. And then COVID comes along. And that just changes everything. And of course, the first impact of COVID that I think most people thought about was the supply of drugs. With less kind of international travel, less kind of freight cargo, less planes and boats arriving, with dealers perhaps finding it more risky to be out on the street, there was an inevitable decline in the availability of many drugs. But at the same time, there was also a reduction in demand for lots of drugs. Drugs that people would normally take when they're out kind of socializing, coke, MDMA, those venues weren't available to people. So I think a lot of people understood, okay, reduced availability, reduced demand. And in fact, I think that's one of the reasons why if people wanted to get hold of drugs, they were still able to early on. Because although there were less drugs available, actually people weren't after most drugs as often. What may not be as obvious though, is that in some areas, we were also seeing an increased supply and increased demand. So of course, the economic turndown for a lot of people meant there were lots of vulnerable young people around who might be recruited into county lines, for example. And that there was obviously a group of people who still realized there was money to be made and therefore were, you know, out dressed up as Deliveroo drivers. There was still a demand out there and there was an opportunity for people to make money. There was also a weird thing right at the beginning, you know, kind of March, April time, where a lot of European dealers would have been bringing in an awful lot of stock for the European summer. And then COVID hits. And we saw examples of dealers trying to offload stock, 2-for-1 deals, actually trying to clear out their supply. But in other areas, we saw people go, ooh, this is going to become a valuable commodity. We're going to increase the price. And of course, although demand for some drugs went down, because of the economic turndown, people banged up at home, being bored of Netflix, there was going to be an increased demand, particularly for those drugs that people could use on their own or just within private settings. And that's going to be some of the stuff that I want to talk about. But before I do that, I just want to kind of highlight that there were some things about COVID that actually were really positive for people with serious drug treatment problems. And that was because governments had to suddenly go, we have a group of vulnerable people. I'm thinking of people, for example, with heroin dependence who are on methadone and buprenorphine, who we currently make go to the pharmacy every single day to pick up their methadone and buprenorphine. And the reason this was done to reduce the risk of diversion and overdose. But it also forced people to congregate, potentially, increasing the risk of COVID transmission. And so early on, a lot of governments took a decision about providing treatment in a less restrictive fashion, which for many patients was amazing, that they could actually be responsible for their medication. They could be treated as adults. And that, I think, for a lot of people was a real opportunity to use treatment differently. And the other thing that was amazing is that some governments who for years had went, homelessness is an impossible problem, there is nothing we can do, suddenly found a way of fixing the problem. There's a lovely example from Dublin. We did a series of 40 interviews with people around the world in the first 2 months of COVID. And I interviewed a fantastic doctor called Adrian O'Hanlon, I think, who runs a homeless service in Dublin. And he said before COVID, there were 1,000 homeless people on the streets of Dublin, and there was a 14-week wait to get methadone. Within a week of COVID, they had housed 750 of the most vulnerable people, and the waiting list for methadone had dropped to 3 days. And what he says, which is really telling, is that it's clear that innovations made under emergency conditions should not be allowed to be rolled back when the virus does. COVID-19 has meant policy barriers in Ireland that have taken years to reduce are being pushed aside in a matter of weeks. If these gains are kept in place, aside from the lives saved during COVID, it's going to be more than likely going to continue to save lives in the future. There is an opportunity here to rethink the way that we deliver treatment and how we engage people in treatment. And I don't want to lose those potential benefits. Anyway, we put the survey together in about 4 weeks, group of people around the world, amazing group of people. And we wanted to focus on things that we thought other surveys hadn't necessarily focused on, particularly the link between drugs, mental health, and intimate partner violence. We had about 65,000 people. We used 55,000 for this report. Germany does our survey better than anyone else because we have an amazing media partner. But we had 6,000 from France, 4,000 from Ireland, 4,000 from Brazil, lots of people from Switzerland, Netherlands, and just over 2,000 people from the UK. And as always, Global Drug Survey promotes with media partners who act as hubs to share the survey. So we work with Vice and The Guardian and media in lots of those other countries that I mentioned. Uniquely, this time we put a report out halfway through as a way of encouraging more people. You can see the difference between how The Guardian report it and how Vice do, basically focusing on the negatives, which is loads more people taking loads more drugs. And there's so much more to that story than just people increasing their use and us pathologizing that use. And the thing I've learned from the COVID survey more than anything else is we can't judge the decisions that people make at a time of crisis when it comes to their use of alcohol and other drugs. Before I run through the findings, I just want to stress all of the cautions you need to have when looking at a survey like this. Measures of change are via self-report. We've got perceptions around availability and price, which is only based on the people that we interviewed. Although we always recruit people through media and online, our media partners vary in the demographics that they tap into. And obviously drug markets vary hugely from Colombia and Mexico and Brazil to Switzerland and Denmark. And it's a non-probability sample, so be careful about extrapolating those findings. And although we're called the Global Drug Survey, we still do a really poor job, although we are trying hard to engage people from particularly African and Asian countries. And our sample is still about 85% white. And we are working to improve the reach that we have in other populations. So if we look at all of those 55,000 peoples, what drugs went up, what drugs went down? Actually, the thing to focus on is this big bar in the middle. which is actually most people didn't really change their drug use very much at all. And that's because most people who use drugs don't use them very often. People who do pills and coke or GHB maybe use 10 or 15 times a year. So you wouldn't expect to see huge shifts. But for drugs like cannabis, for benzos, opiates, we did see increases, fairly predictable and consistent increases. There's a few random things like this. You've got about 30% of people increasing their use of GHB. We've got about 30% of people increasing their use of crystal meth, a similar proportion decreasing it. And we need to do some more work to identify what particular population chose to increase the use of these drugs and for what reason. Was it just for, private house parties where chemsex was being involved, or was it people using GHB now as a way of managing anxiety? Was it people using crystal meth because coke was too expensive and they couldn't get hold of it? If you ask most people around the world what did they think happened to availability, actually on average about 50% of our respondents went, look, availability went down. But I think what's really interesting is that the purity and range of drugs still remain pretty good. Purity normally drops when availability falls because people are trying to, adulterate their drugs and make them go longer. So this for me says if you wanted drugs, you could get them. And overall, the drugs you were getting were still probably reasonably good quality. We didn't see the shift in lots of people moving to the dark net for the first time, which we suspected might happen. In fact, only 2% of people who said they'd bought their drugs online said they had done so for the first time during COVID. This just talks about value for money. And what strikes me here is that the one illicit drug that went up more than anything else during COVID was cannabis. And I think people put their price up. Why? Because people knew it was in demand and effectively people felt it became poorer value for money. LSD is also fairly striking, but we've seen the price of LSD double over the last 2 or 3 years. And again, I think that's about opportunity cost because so many people are interested in using LSD now for other reasons than to have an intense experience. In terms of were the changes in commonly used drugs consistent across countries? Yeah, pretty much. Virtually every country we looked up, there were 40, 50% of people saying they were using more weed. You look at MDMA, you can see 60, 70% saying there was a reduction in MDMA. So these are cross-cultural trends that I think are pretty robust. If we look at why the demand for certain drugs like cannabis and benzos went up, well, that's because very often people were banged up at home, they were bored, they had more time to use these drugs. Yes, you had a proportion of people who were using to manage depression and loneliness, but boredom and time on your own is a great opportunity for some drugs to walk in. And you can see, if we look at people who reported using cannabis on their own, we've got over 50% of people saying they were using more cannabis on their own. If we look at why did people have a decreased demand for certain drugs, it's as you would expect. I'm not seeing my mates. The venues I use these drugs are no longer available. But it's interesting that some people just didn't feel like using drugs like coke and MDMA if they were at home or they weren't with their mates. And it just makes sense. Drugs that are social, that you enjoy most when you're with other people, are going to be drugs you steer away from when you can't go out and play. I want to focus now just on the UK sample, since I'm imagining most of you are probably from the UK. So the first thing I'd say is about 60-40 male-female. We had a quarter under the age of 25. And in terms of the mental health of our sample, this is the global sample. 30% of the global sample had previously been diagnosed with a mental health condition, most commonly depression and anxiety. In our UK sample, it was almost half. And we used a screening tool called the Kessler, which is a measure of severe mental illness. And above the cutoff threshold that we used, 1 in 5 of our UK sample met the threshold for being severely unwell. You're thinking, well, why would that vary so much across countries? I think it had at least something to do with how well people thought their country was coping. So we asked people, what score would you give your country's leadership during the time of COVID? New Zealand came out top, but these are the global scores. And you can see 50% of people are giving their countries 8, 9, and 10. They're basically pretty impressed. I can tell you that Brazil came bottom, where 70% of the nearly 5,000 Brazilians gave Bolsonaro 0 out of 10. Closely followed by the US, where I think 50% of people gave the US and Trump scores of less than 2 out of 10. I wasn't expecting that these would be the UK scores, where you've got over 50, 60% of the sample scoring the UK as 3 or less out of 10. At a time of crisis, you look to your country leadership to make you feel reassured and safe. And this says to me that the UK hasn't done that. In countries like South Africa, they took the decision to ban the sales of alcohol altogether because of the link between alcohol, mental health, and domestic violence. And so they were shut down. In the UK, God forbid we would close off access to alcohol. I mean, pubs were closed, but people could still drink. And one of the most consistent findings reported in the press from lots of studies is that lots of people increased their drinking. And you can see from this, about half of the UK sample reported increasing more on a drinking day, and about half reported drinking more frequently. And 30% increasing their binge drinking. Increasing drinking without any context or any idea of the consequence is not very useful. So what we were interested in is, well, why were people drinking more? And did it matter whether or not you were someone with a pre-existing mental health problem? So here you can see that, yes, you were more likely to increase your drinking if you had a mental health condition, 51% versus 43. But that's not the most interesting finding from alcohol. It's about why people were increasing their drinking. So for everyone, regardless of who you were, the biggest reasons that people were drinking more is they were bored and they had more time to drink. But for people who had a pre-existing illness, they were drinking much more frequently because they were feeling lonely, they were more depressed, they were more stressed out what was going on. And that function is really important when you look at what the outcome was of drinking more. And you've got 50% of people drinking more alone. And the truth is that for people with a pre-existing mental health problem, who we know were drinking because they were lonely, depressed, finding it difficult to cope, twice as many people reported worsening mental health following increasing their drinking than did for those people without a pre-existing mental health problem. Only 4% of people with a mental health problem who increased their drinking said their mental health was better. And you can see across the board, people with a pre-existing mental health problem reported poorer physical health, poorer performance at work. And what that says to me is that the most common go-to drug coping mechanism that people use to is the one that's actually diabolical for their mental health, because it makes people feel worse. It can increase your anxiety the next day of heavy drinking. It stops medication working. It decreases your motivation. And interestingly, alcohol also is an immunosuppressant and increases your vulnerability to respiratory infection. So combine that with poorer physical health and potentially putting on weight. It's a really lousy drug for COVID. What about weed? Well, you can see a very similar proportion of people, regardless whether they had a mental health condition or not, increase their consumption of cannabis, 40, 50%. Why were people using more weed? For exactly the same reasons why they were drinking. Bored, time at home. But you can see here, again, that for people with a mental health condition, they were using more cannabis to cope with anxiety, deal with loneliness, and because they were feeling more depressed. So for exactly the same reasons, and more so than people without mental health conditions. So the reasons and rates of increase for both cannabis and alcohol, regardless of who you were the same. What's really important was the impact of increasing alcohol versus cannabis use for people with a mental health problem. So although it is reasonable to say that twice as many people who increased their cannabis use with a mental health problem reported poorer mental health, 18% versus 9%. What's most striking is that you've got a quarter of people with a prior mental health condition, exactly the same as without a prior mental health condition, who were saying that increasing their cannabis use improved their mental health. Yes, it had negative effects on work performance and their physical health as well, but this is in stark contrast to alcohol. where it was 4% of people said increasing my drinking made me feel better. This means we can't dismiss the idea that increases in cannabis use, even among people with pre-existing mental health problems, may be functional. But the bit that the headlines missed altogether, we're thinking about the 1 in 3 drinkers who cut their drinking down and the 1 in 4 people who use cannabis who cut their smoking down. That's a really important group to focus on. And what's absolutely wonderful here is for that 30%, people who reduced their drinking felt better. They had improved financial health, improved physical health. People with mental health problems had significantly better mental health when they cut down drinking. So the smart choice for most people with a pre-existing mental health problem was to drink less, but the smart choice for virtually all the population, for financial, physical, and mental health reasons, was to drink less. But nobody shouted about that headline. It was just a much better headline to go, people are drinking more. Likewise, if we look at the impact of people using less cannabis, it's not as clear cut. 21% of people who said they had reduced their cannabis use said their mental health was worse. 20% said it was better. And what this says to me is that although people with mental health conditions who increase their cannabis use can obviously deteriorate and it can be worse for their mental health, for other people, perhaps using at only slightly increased levels, we can see benefits, and we need to understand better the therapeutic role, even when used recreationally, for cannabis with people with mental health problems. At the time COVID came out, lots of groups like Global Drug Survey, and The Loop, and Drug Science put out harm reduction messages for people. And despite the fact that we were engaging with a group who you would expect to have seen those, 85% of people said they'd actually not seen any harm reduction messages related to alcohol, drugs, and COVID. But that didn't stop people just using their common sense. 50% of people said they had now made sure they weren't sharing joints and they weren't sharing kind of tutors for coke. They were trying to minimize contact with other people. I mean, a quarter said they were stocking up on drugs. But this says to me there is an awful lot of common sense among people who use drugs when it comes to understanding the socialized nature of drug use. And in Global Drug Survey 2021, we've got 2 very detailed sections on how people have changed their use of coke and cannabis. And, you know, just how careful they're being. You know, are people still automatically snorting a line of coke and then rubbing their nose and face, or are they putting a mask back on? Are they sharing their drugs with other people? I don't know. Although we saw lots of drugs go up, I did say that there were fairly big drops in coke and MDMA. And did that make any difference to people's lives? Yeah, not surprisingly, it did. 50% of people who reduced their coke use said they were financially better off. People reporting better mental health, better physical health. So using less drugs actually can be quite good for your health as well. We saw, you know, less pronounced, but very similar sorts of trends for people who were using MDMA. And I think that, you know, it goes back to the general kind of opinion that the people who get the most pleasure from drugs are basically people who don't use them that often. Using drugs frequently builds up tolerance, increases the risk of, you know, harms, and often leads people to polyuse patterns because they're no longer getting the buzz they want just from taking a single drug. The last thing I'll mention before I stop is we also looked at work on intimate partner violence, which my colleague Gail Gilchrist led. And I guess for me that highlighted the fact that although COVID put us all in the same storm, we were all in very different boats, and how we navigated our way through COVID really depended more than anything else on those things that we had in our life that were positive and good. You know, you were lucky if you had a garden, a roof over your head. But you were also really fortunate if you started COVID with a strong positive relationship. About 25% of our sample said in the 6 months before COVID, they had either perpetrated or had been a victim of various sorts of abusive behavior, physical, emotional, sexual. And 40% of people who had a relationship already characterized that abuse reported an increase either in victimization or perpetration. And that group are hidden from sight. But the effects not just on that individual who is the victim of that violence, but also on children in the home, can also be profound. And I think that's something that we've only just started kind of scratching the surface on. I think that we haven't yet got the end of this story. I'd expected by now there would have been some sort of release and people would have been back out in the world, and I was expecting to see a lot of people offloading lots of coke and MDMA, and I was worried about people returning to use for the first time and caning it and ending up in problems. I think that clearly where we are at the moment means that we haven't seen that. And so my guess is the challenge for the 50% of people who have reported increasing their use of drugs is to see whether or not that new normal is healthy for them. And if not, how can they go about increasing the space they have between periods of drug use, and what are the kind of social and network supports they can use to protect themselves. I do worry there will be a percentage of people who will have moved from borderline problematic use of a drug like cannabis and alcohol to now having got used to drinking and using every day. And when that day comes that they need to return back to a more regulated way of functioning and interacting with the outside world and work colleagues, adapting to not using those drugs every day, I think may be a real challenge for some people. I have the most horrible feeling that I probably spoke insanely quickly throughout all of that. So I'm going to stop and hope it wasn't too quick. Before you ask any questions, just remember there are limitations to the data I've presented. There's a lot more analysis that we need to do, and obviously over the coming months we'll be writing up various papers to highlight some of the most interesting findings. And the next survey also has a whole bunch of things related to COVID, particularly how people chose to access support for their mental health and drug and alcohol, and the acceptability, for example, telehealth. I think we need to know more about that. The truth is that changing drug laws will make things better for people, but we need to change the culture of using drugs and the conversations we have about drugs first. And I strongly believe that, the solution to, drug use isn't tougher drug laws or anything else. It's just about letting people grow old. By that, I mean getting people through the risky teenage and early 20s years until they just move on and do other things in their life, apart from just using drugs. And I think most people make that transition really well. And most people do use drugs sensibly. We just need to make it easier and less stigmatizing for people to have conversations when they're worried. And we need to stop pathologizing the use of any illegal substance. I'm going to stop.